Good afternoon, everyone, and welcome to another edition of the Firman Forum. My name is Warner Abrams, and with us today is James Picard, Physician's Assistant, Near North Health Services Corporation. Welcome.
Thank you.
Mr. Picard, why was Near North Health Service Corporation established, and how long has it been in existence?
Near North has been around for 45 years.
Mm-hmm.
We're celebrating our anniversary this year. We were created to provide low-cost health care to those who do go without insurance or have no medical coverage.
Okay. How many locations do you currently have?
We have 7 at the time.
7 locations, okay. And this is your 45th year?
Correct.
Okay. What are Near North Health Services Corporation service areas, and what populations are targeted, since you have 7?
We target all over the city of Chicago. We help both anybody who has no insurance. There's clinics on the south side and Cottage Grove at 4800, and there's at 43rd in Berkeley is our big clinic called CoMed HomeMed.
They're beautiful too, by the way.
Right. They won some awards for the design.
Yeah.
So on the north side, we're in the Caprini Green, Near North area on Clybourne, right at Division.
Mm-hmm.
Winfield Moody's the headquarters.
Mm-hmm.
We have locations uptown, is Lawrence and Broadway.
Mm-hmm.
And west side, we have a clinic called Louise Landau in the corner of Chicago and Kedzie.
Oh, okay. You got the city pretty much covered.
Yeah, we do.
Yeah, that's a good thing. How long have you been in your role? How long have you been with been a physician assistant?
As a PA, I've been a PA for 9 years.
That's
I graduated 2003 from Midwestern University,
Mm-hmm.
and I've been with Near North for the last 18 months.
Last 18 months. Okay, you like it there?
I do.
Yeah.
It's hard work, but it pays off.
What have you seen? I know what we're going to be also talking about is Men's Health Week, which is coming up starting June 11th, right?
Correct.
And from your experience over the years, have you seen the most prevalent thing men are coming across dealing with health issues?
A lot of health problems start from obesity.
Okay.
And that leads to a lot of other problems such as diabetes, high blood pressure,
right. Okay.
dyslipidemia, like bad cholesterol levels, and then we go from there.
Okay. And I know dealing with obesity, especially now in younger people, is going to be a problem. I read a report saying that the young children of today will not outlive their parents due to obesity issues.
Yeah, it's a shame.
And what do you think that's coming from? The fact that I think we've grown as a society smart enough to know what's good for us, what's bad for us, things to eat. What is the problem? Why are we having such a high influx, you think, of childhood obesity?
I think a lot of people are just lazy. They need to get out there and do some exercise. We spend too much time in front of the TV.
Oh, well, on
the video game.
Yeah.
On the iPad,
Yeah,
So.
that is so true. So they need to get out and move more. But then again, it's a combination of things. The way society has progressed, back when I was growing up, it was not so bad going out, wanting to get out of the house and play. But now you have to be so careful. But they could do other things. I think we helped a lot. That's one video. You can move around and things like that. I think if you have to do video games, you should have video games where you can at least move around, jump around, things like that, And it starts June 11th, correct? Men's Health Week. Tell us more about that.
It's a program we put on every year. It's free of charge for any male that would like to come in and be screened. We do their check for high blood pressure.
Mm-hmm.
We check their cholesterol level. We check their sugar for diabetes.
Right.
And then we do an optional prostate screen, because it's come under scrutiny lately if it's worth treating or not, or screening for.
Right, for prostate. And is there a certain age that a man should get that screening for prostate?
It has been 40, but now they've recently changed the rules on the U.S. Prevention Task Force to anyone who has symptoms. But usually it used to be about 40 years old if you're African American, maybe 45 if you're Caucasian or any other race.
Okay. Are there certain types, depending on the race, the ethnicity of a person, of a man, that they're prone to certain diseases?
Oh yeah, of course. A lot of it is genetic makeup too. So different ethnicity, different risk. So if you have family history of diabetes, you should probably be screened a little bit sooner than somebody else. or if you're of like a Hispanic race, you should be checked a little, or Indian, American Indian,
Native American.
you should be screened as well for diabetes a little bit sooner than later.
Okay, that's very good. That's very good. And what's the number to call?
The number they want you to call is 312-337-1073, and then ask for extension 208 for Miss Kimberly will help you out.
Okay, very good. I believe we have a caller on the line. Good afternoon, caller. Comment or question?
Hi, good afternoon. I have a question. I wanted to know, how often should men over the age of 40 have physicals?
That's a very good question.
Yearly.
So yearly.
Yeah, you should get a yearly checkup.
Okay.
If not, the best you can get to about around a year, depending on what your results show on your lab studies, and then we go from there.
Okay. What other services does Near North Health Service provides?
The main clinics, there's a lot of healthcare, so we have our areas in pediatrics, we have general medicine, like internal medicine, and we have OB-GYN services.
So it's families, not just men, it's everybody.
It's everybody.
Okay.
And then we have programs that latch off to the WIC program.
Okay.
We have educational programs for diabetes, stress management. We have breastfeeding clinics, anything and everything you can think of.
Okay. And for those who do not know what WIC is, W-I-C, it's Women, Infants, and Children.
Right. Correct.
Okay, it's a program. Make sure that you get food, milk, and things
Right.
of that nature. Okay. We're talking today to Mr. Picard from Near North Health Center Corporation. Give us a call here on Hotline 21, the Firman Forum, at 312-738-1060. I believe we have a caller on the line. Good afternoon, caller. Comment or question? Yes, caller. How may we help you? Caller? Caller, comment or question?
Hi, good afternoon. I have a question.
Yes.
I wanted to know which locations are the men's health clinics are?
They all are. So there are more other locations that I didn't mention. There's one at the Denny Clinic, which is in the YMCA building on Chicago, right by State. And there's another, I said at Cottage Grove, is 4800. But you can call the main numbers 337-1073, extension 208, to get dates and times. The big three centers, which is COMED on the south side at 43rd and Berkeley. 1276 North Clybourne is Winfield Moody, and Louise Landau 800 North Kedzie. They will be open Monday through Friday to do the screenings from 9 a.m. to 4 p.m.
And that will start June 11th.
Monday.
It's a week long. I'm going to put up the flyer. And tell us more about this, the flyer here.
There's some information on there. Just kind of telling everyone what the screening tests that are going to be done for diabetes, cholesterol, prostate cancer. HIV testing is available, and high blood pressure check. There are going to be some raffle giveaways. They're going to get a voucher to maybe possibly get a haircut on site.
That's great.
And then they have other educational, what do you call it, seminars.
Right. And
for people to go and learn how to healthy cook or what they need to do to maintain a healthy lifestyle.
And you have interactive workshops, and you also have it in Spanish. Correct?
There you go.
Se un hombre con su salad.
Right.
June 11th through the 15th, 9 a.m. to 4 p.m. Okay, very good, very good. And for those men who may be hesitant to come out or maybe afraid to get themselves checked, how would you speak and reach out to them to let them know that that's something that they should do?
You got to do it up for yourself, you know, like part of being a man is taking care of yourself and taking care of your family and those who you support. So it's not gonna hurt you. They were gonna squeeze your arm, poke your finger.
That's about
it. That's about it.
Yeah.
So
get some blood.
Give some blood if you need it, you know, but it shouldn't be too bad.
No, it shouldn't be too bad. But I know. I mean, I have a dad. Can be stubborn in that way too, but I know we generally take better care of our cars than we take care of ourselves.
Correct.
So we just got, especially if you have family, wife, children, you got to be there for them. The only way you can do that, I believe in taking preemptive strikes when it comes to your health. It's better to know than not know. Prevention, correct. Right. So what's the number again, Mr. Picard?
312-337-1073, and you ask for extension 208 for Miss Kimberly.
Okay. I believe we have another caller on the line. Good afternoon, caller. Comment or question?
Question.
Yes.
What causes breast cancer in men, and how can a man prevent from getting breast cancer?
That's a very good question.
I know, it's a tough one, but a lot of it is genetic. And what they can do to screen, you can just look for changes in the breast tissue, like if you have a lump or pain or swelling that's on one side, not the other. But there aren't any like routine screening tests that you do for men for breast cancer besides just notice a change or feel a lump.
Okay, very good. What are some of the ways men can improve their health overall? Self-exams?
Self-exams, eating right.
Okay.
Make sure you get your fruits and vegetables in.
Right.
Exercise on the regular.
Right.
30 minutes if you can every day. If you can't do it all at once, break it up. Like take the stairs, park far away, and walk to work. Ride your bike to work. You know, try to just act healthy, live healthy. Don't smoke. Drink in moderation.
Right.
All those things that can help prevent disease and disease processes.
But then again, I think you hit the hammer on the nail, speaking to obesity in this country and how it's leading to so many other health issues.
Right.
What's the major health issue from the effects of obesity?
Well, when you get obese, your body it's harder to manage the level of sugar. You eventually become pre-diabetic.
Insulin levels.
Right. Your insulin levels go up. Your body doesn't respond as well to the amount of food you eat and the sugar management. So then we do a test for you called the A1C, and it assesses the risk of how well your body controlled the sugar level over the last 3 months. And based on for Men's Health Week, we're doing fasting sugars just to see if you're diabetic or not.
And what does that mean for those who do not know?
It's a finger pick, and then we see if we can get you fasting, that would be the best. But if not, depending on the number that you get at your test, we can determine if you are diabetic or not.
And meaning that you don't eat anything the night prior before leading up to your test.
Right.
Right. So that's the best way they can gauge to see exactly.
Right. So we can come in and get a random sugar or a fasting sugar if they haven't eaten, and then we go from what number you get to decide what's the next step.
Right. Then that's another question. When, let's say, will there be also HIV testing?
Correct.
What follow-up will you have if somebody tested positive for HIV or they have a very high glucose reading, meaning their sugar? What's the next step for them?
We will do our best that day to take care of if it's an emergency or not, because we've had those before. And then we go set up a follow-up appointment with our services and help them manage whatever the new diagnosis may be. And say for HIV, we have a whole setup, a whole program that's led by a group of people who that's their job to manage and help with HIV care prevention. Okay. And it's rapid testing. We get an answer within 30 seconds, so you know yes or no.
Because you can do it orally also.
Right. The one that we use is actually a finger prick, so it's a little bit more accurate.
Okay. That's very good. That's good to know. We were talking about but the obesity problem, also like certain communities are marginalized and they don't have access to proper nutritious food. You know, there's food deserts.
Right.
What do you recommend for those who have a hard time getting fresh fruits and vegetables in the areas that they live?
It's a tough question, and I don't know if there's an easy answer. So, like I was saying last year when I was here, we were talking about Walgreens and their initiative to bring food into the pharmacies. And you can see now it's starting to grow a little bit more.
And you're right, they have.
So that's my plug for Walgreens.
Okay. No, but that's a good thing, because I've noticed it seems that instead of more and more Walgreens are popping up everywhere in the urban areas.
Right.
And I think that if they do, I've seen some with some fresh fruits and vegetables. And actually I bought apple and bananas there from Walgreens. And I just think it's a good thing. It's a good thing to have people to have the choice, to have the access, not to always having to have to eat, the greasy foods
Fast food,
and the fast foods. Tell us more about Men's Health Week. It's going to be a very long week for you guys coming up.
We'll be busy.
Yeah, I'm sure you're prepared.
We're waiting. We're ready.
Oh, okay. But it's going to be starting on Monday, June 11th. And numbers again for contact information.
The best number to call is the main office at Winfield Moody. We're going to do 312-337-1073. When you need to ask for Miss Kimberly, and she can direct you to the best office that's closest to your location.
Okay, Mr. Picard, again, we'd like to thank you for being with us. This is so important for men to get out there and find out what's going on, with inside their bodies, to take care of themselves. So if they take care of themselves, they can take care of their families and their loved ones. And one more time, the number to call for Men's Health Week.
312-337-1073, and extension 208 is for Miss Kimberly.
Okay, any parting words you'd like to say?
Get out there, get checked. I'd like to thank you again, Mr. Warner, for having us out from near north.
You were quite welcome, and we're glad that you came out. And again, Men's Health Week next week, June 11th through 14th. So, 15th, actually.
15th.
That's right, June 11th through the 15th.
Have a good one.
Have a good one. I'm Warner Abrams for the Firman Forum. Have a good day, everybody.